Hi, I'm Dr. Noel Lucas from Oasis Pet Hospital, and I'm going to answer some questions you might have about end of life for your dog and just making some of those, answering some of those questions you might have about making some hard decisions about your senior dog as they get much, much older. So Mackenzie is going to ask me some of those questions that you might have.
Dr. Lucas, how can I evaluate my senior dog's quality of life?
Yeah, so evaluating quality of life, one of the first things that caregivers will think about your senior dog, and maybe when you're making that final decision, if it's like ready, if they're ready to sort of make that final decision, is, well, if they're still eating, then they're still wanting to be with us, which is true. But if you have a dog that's no longer able to get up or is getting up with such great assistance, they're mixing up their nights and days, they're house soiling, they're not making it outside appropriately, but they're still eating, so that's a quality of life indicator. For me, that's not always what I think about as when a dog we might need to consider the end of life discussion, because dogs are animals, and in the animal world, eating is just an instinctual. It's so for us too, but it's not necessarily always correlated with quality of life. So I really talk about maybe, if they're still eating, that's not always a quality of life, but if they stop eating entirely, we all know that that's okay. They've given up. If a senior dog has stopped engaging with the family, especially their favorite family members, maybe they're always just kind of toddling along after you from room to room. They're just kind of in your space, and that's their normal place to be, but they've stopped and they're now just staying in their kennel, or they're staying on their pet bed, or they're staying in a bedroom, and they're not really coming out and engaging with us. That's a decreased quality of life concern. Of course, if it's just so painful for them to get up and down, and they're no longer really able to do those normal functions, they forget, while they're going outside, they go outside and then they just forget, and they come back inside and they potty because they've lost some brain function. So I start looking at those things as kind of being quality of life indicators.
How can I tell my dog is in pain?
Telling if your dog is in pain can be very hard for caregivers and pet parents to determine, even for us as veterinarians sometimes as well. Because again, dogs are animals. Animals do not get sympathy from each other when they have pain. So they don't vocalize like you and I would. We like to talk to each other and tell each other how much in pain we're on, or vocalize, because we get sympathy from each other and empathy. Dogs do not. They actually would get picked on and potentially ostracized out of their group or pack if they actually vocalize pain. So they will hide it, they will mask it. So vocalization is not a sign of pain, but dogs that don't want to get up and they're more tired and resting and lethargic or sleepy can sometimes be sleeping because of pain. They may decrease their appetite, so they're still eating, but they don't want to eat as much, so that can be a sign that they're in pain. They're panting a lot more than they used to. So they're just panting throughout the day or night, and it's just a persistent low-grade pant. That can be a symptom of pain. They're not hot, they're in pain. So I start thinking about some of those different things that dogs do that indicate pain as opposed to vocalization.
What is the difference between hospice and palliative care for my senior dog?
Yeah, so if we put a pet in hospice, we put your dog in hospice care, they're pretty much, we've decided that we can't or aren't willing to put them through any more treatments of any type. We're gonna let them stay at home. We're not going to do any more tests or procedures. We're going to manage their pain. We might, but they're really pretty much at the days or very soon they're going to die of whatever it is that they have been diagnosed with, and typically it's cancer or organ dysfunction or failure. Palliative care may be a little different, where we do have maybe some treatment that we can do. Say there's a tumor on a dog that's in a very difficult place for us to remove, or maybe we can remove it, but we can't cure the problem. And so we might do some palliative care where we know that we're not curing the problem, but we're gonna do some treatment to help improve quality of life. So we might do a tumor removal just to gain maybe 6 months or longer. Maybe we will do some alternative treatment for the disease that we know that they have, even though we know it's not gonna cure, but it's gonna help improve their quality of life, like maybe nauseous medications, appetite stimulants, pain medication. But the expectation is they're in palliative care, but they may end up having a little bit longer life than that hospice patient. A hospice patient is a very short period of time that we're talking about that they're going to be with us.
So what is euthanasia for a senior dog?
Yeah, so euthanasia is when we put your dog to sleep, and it is a very hard decision for our caregivers to make. It's hard for us to do. We are going to definitely walk you through it and handhold you through the procedure. It is kind of scary for us to have you, have your dog be put to sleep. So we know that that's worrisome for you. So we do a really compassionate job of being able to euthanize your pet. And it's the word euthanasia means to put them to sleep. Most people know that. There's a lot of questions about how we do it. Each veterinarian may do it a little bit different, or vet hospital, but essentially it's fairly similar. With most of us, we will make sure that we know your wishes. Like if you want to do cremation, do you want to take that pet home and bury them? Do you want to have their remains back with you? So we kind of find out what your wishes are, and then we will always give them some kind of sedation. So whether they've been hospitalized and have an IV catheter, we will use the IV catheter and twilight them so they don't have any consciousness during it. If your dog comes walking in or you carry them in but they're pretty alert, we will always really pretty profoundly sedate them before we move on with the final injection. That is the overdose of a medication called pentobarbital. That is the end of their life injection, and it is fatal, and it is calm and quick. Mm-hmm.
Would it be better to let my senior dog pass away on their own?
That's a great question. Would it be better to let my senior dog pass away on their own? Veterinarians highly encourage that not to happen, because we take an oath to uphold the human-animal bond and also end suffering. And when a dog is at end of life, if they're in pain, we know that's suffering. Dogs aren't always in pain when they're in end of life. They could just be suffering. They don't want to eat, they're nauseous, they are so tired, they have headaches, they're super anemic, they're really weak, they can't get up. So there's all kinds of reasons that maybe they're not in pain, but they're suffering. And we would never want your dog to suffer until it passes away. That just is inhumane to most veterinarians, but we do want to make sure that we support your wishes and your own sort of feelings about end of life. So it's really important to talk with your veterinarian, and if that's what you decide to do, then we're going to make sure that we're partnering with you to give them pain medication or help them feel as comfortable as they can as they're going through that very final moments of their life. But that's kind of how we think about it as veterinarians. So I hope that helps answer some of the questions. These are kind of some challenging questions here at the end, but they are questions that you would have, and it's important that we answer them And so if you have some real specific questions for veterinarians, especially about your senior dog, especially about that end of life, really please partner with your veterinarians. They're here to help, and we want you to make appointments or talk to them. So I hope this answers some of the questions that you have about your senior dogs, and how to help care for them as they get older. It's certainly been fun answering some of the questions that you might have had. Thank you so much.